Hey everybody, good to see you again. This is Dr. Drew, the movement doctor with Motor Specialist Physical Therapy, talking about series on no more pain. And today we're gonna be talking about low back pain, the best way to take care of that and handle that with low back pain. So we're talking about low back pain and, how do we treat it? So we have an actual real client here, Jordan, professional soccer player, who came to us specifically about low back pain. And she's here to kind of talk to you what she's tried and now what's helping her.
So originally I came here and I just thought immediately all my pain was the back was the problem. I thought my back was super weak. And originally I was like, yeah, we need to do this. And obviously I don't know anything of what I'm talking about. But I originally went to a chiropractor and I went to acupuncturist, and they kept treating the back muscles and all the muscles going up and down my spine. And I came here and we started treating my core, and we actually realized that that was the problem. I have a very weak core, and that's what we needed to strengthen in order to get better.
So most of the low back pain that we see, obviously in the lumbar spine, is something that may be misdiagnosed. So when you think about the way the body works, it's a joint by joint approach, right? So we have our ankles that need to be mobile, our knee to be stable, our hips to be mobile, our lower back to be stable, our thoracic spine to be mobile. So if we kind of stick with that framework of thought in terms of how our body is designed, then would it make sense for us to, for example, go to a chiropractor or get manipulated in the lumbar spine? Because what does that actually do? That actually causes more mobility. And what we need in the lumbar spine is stability. So usually when someone's coming in for low back pain is because they're having some issues, but they don't know it yet, in their hips or in their thoracic spine. Either their hips are not moving well enough, so their lower back has to compensate, especially for rotational athletes, like our soccer athlete here, who always has to rotate to kick the ball with one foot planted. So if she doesn't have that mobility to rotate off of a single limb, then what's the next closest segment to compensate? It's her lower back. If she doesn't have enough rotation in her thoracic spine for a pitcher or an overhead athlete, then again, thoracic spine, the closest segment, is going to compensate. Even though they may have low back pain, they're coming in for low back pain. What we really want to do is focus on the hips. So just by looking at hip motion here, specifically internal rotation, we want to really look at see, is there limitations here? Because that may be a source of their lower back pain. So you want to be able to compare both sides and see internal, external rotation. Is there enough range of motion here? And again, this is more of an open chain test. We're also going to look at it in a closed chain test as well. But this is a key way to understand a little bit more of what's happening with their lower back. Okay, now if we want to look at thoracic spine mobility, we can have their foot placed down, arms across the chest, and just allowing them to just fully rotate through thoracic spine. And you're looking here to find out, do they have limitation on one side versus the other? Another way to look at range of motion is prone and looking at internal, external here. So here is internal rotation, here's external rotation. And you want to see, is there any limitation there? Again, when we're talking about the lower back, it's easy to look at just the side of the pain because that's where they're complaining of, but this is not the source of it. So you could check it, you could assess it just to make sure that it's nothing isolated in there, like a facet joint that's locked. So about 70% of the population has lower back pain. And I think this is something that can be treated and managed more efficiently if we look again above and below. So we really want to make sure that we're not manipulating this area. Again, we want this to be more stable. So what do we do for stability for the lower back? The whole core wraps around. The deepest muscle of our abdominals, the transverse abdominis, runs all around through here like a brace. And so that muscle actually has attachments to the lumbar spine. And we want those guys to be turned on all the time. And that's what's gonna help give us our stability. And again, we can work on mobility here and mobility in the hips. and stability right in this area. So a quick assessment for us to kind of notice just off the bat how much rotation they may have is if we're focusing on this left side right here, we're gonna have the patient go all the way around to the other side to really see how much range of motion, specifically internal rotation on this side, they actually have. Good. And then if you come back from the other side, come back around here, again, with the foot staying in the same spot, you just wanna see how much rotation do they have here. Again, relative internal rotation. So when the pelvis is moving over a fixed femur, this is now internal rotation of the femur. So another way to check now functionally how much internal rotation they may have is by hanging leg position, where they're now isolating the front leg. And this is really good for any type of rotational athlete. If she was a thrower, if she's kicking the ball, if she is playing golf, whatever it may be, because this is a very standard position with the lead leg. So what she's trying to do here is, without moving her foot, without moving her knee, she's moving her pelvis over her femur, and you should feel a really big stretch right in that hip joint. This again will help increase a lot of the discomfort that someone might be feeling in their lower back. And you can do this as a quick assessment and reassessment. So if something is painful in someone's lower back, have them do an exercise like this, or have them something specific for the hip, and then reassess that lower back exercise, and you may see a big difference in their symptoms without even touching their back. And then you know for certain that it may be a hip problem more than it is an actual lower back problem. Last thing I tell people to do is get an MRI or an image on their lower back. Why is that? Because typically, once you see what's going on in your lower back, your brain automatically associates every pain that you're feeling based off that MRI. There was a study done in the 1980s where they looked at 100 people, all of them got MRIs. Some of them had low back pain, some of them didn't have low back pain. When the MRI results came back, the people that didn't have any low back pain actually had worse MRI scans than the people with low back pain. So what is that saying? That's saying that the MRI isn't who you are really. Those results do not dictate who you are as an actual person and as an actual client, because even though their MRIs looked horrible, they had no symptoms. So once you get an MRI, then you start knowing that your pain is worse than you may have thought, and now everything becomes a problem. Thanks for watching this video on No More Pain with me, the Movement Doctor. Please don't forget to like, drop a little comment, and subscribe to our channel for more great content.